Okay, so today we have a patient in that we're going to be doing our smile in a day. And the gist of this procedure is that we're going to take her smile as it is and we're going to transform it into a beautiful smile within a period of a day. It's a long procedure, but the results can be phenomenal, as you'll see. So what I wanted to share with you here is it's truly not in a day, because we do need to see the patient approximately 1 to 2 weeks prior to their appointment. And at that visit, we take models of their existing teeth and we take photographs. And here what we have depicted, or this is actually our patient's models of her teeth the way they are. And then here is her smile the way it is in her mouth. And this photo here is a retracted view of her teeth the way they are. So I'm going to spend some time with her models in these photos, and I'm going to transform these models into what we call a mock-up. And the mock-up is basically me taking the teeth and shaping them to the way that I know that they're going to look good in the finished result. So it's done with plastic materials, and it just takes a little bit of time. So we took her models and we went from this to this on these stone models in preparation for her visit. Then we make an index, and this is out of a goopy material. It's an impression material over this mock-up, and we're going to use this in her mouth. At her appointment, we're going to take her existing teeth, make sure she's numb. Oftentimes we sedate these patients, and we're going to prepare these teeth as necessary for crowns or veneers or whatever it needs, whatever the tooth needs. And then we're going to, using this index, make her temporaries. And sometimes if the patient has had enough and it's a long day, sometimes the patient will go home with the temporaries looking beautiful. But more often than not, we can take those temporaries and then, utilizing our software, our computer software, it's called CEREC, we can actually copy these. So in our patient, what we're going to do is prepare her teeth, then we're going to make her temporaries, and then we're going to use her temporaries in her mouth, copy them, and with those copies make her 6 brand new beautiful restorations. So right now I'm working in the CEREC software, and the CEREC software is a software that allows you to digitally design crowns and then subsequently mill them with the machine that we have over there. So in this cosmetic case, basically we're taking and we're doing 6 individual crowns in this patient's mouth. And so what I'm doing here is I'm telling the computer to copy what we've temporized in her mouth. And so this white line that you see here is just me telling it to copy what we have there. And you can see we just kind of need to digitally go around this tooth, this white line, and I'm just outlining what I want copied. So the idea when we do this is that we've created these temporaries in her mouth. She likes them. In fact, she loved them. And so now I just want to copy them. So I'm just going through here, and that's exactly when I have this computer help me design her crowns. I just want it to copy what she has. Okay, so now that we have that done, now we're going to go through, and now the computer is going to make 6 crowns, and we call these proposals. Okay, and the proposals are based on it copying the temporaries that we made in her mouth. So it takes it a second here, and then it's going to give me six crowns, and then I'm going to take those 6 crowns and I'm going to begin to smooth them and change them up so that they look good in her mouth. So now we have the computer's rendition of her 6 crowns, and what we're going to do now is just clean them up one by one and make sure they all get my approval, basically. So this is the CEREC block that we've chosen for Stacy, and we've chosen the color. In her case, it's an A1, and so we showed you the design in the computer software. So this is the actual block that I'm going to now put into the milling machine. This over here is the milling machine. And we're going to remove the old block that we used on our last crown. Okay. We're going to place our new block into the milling machine and tighten it back up. Okay. Make sure it's good and snug. Okay. So now we're going to close this and we're going to go ahead and start the milling process. So the block is in the milling machine, and what's happening now is the milling machine is checking to see that the block that we put in is the exact same block that is in the design in the computer. So it does what's called a touch test. So it's going to touch this block and make sure in fact that it's the right one. After it does that, it will then start to mill this crown. The way this milling machine works is it's got a pointy burr on one side and a flat burr on the other side. And the pointy burr does the top of the crowns or the anatomical areas, and the flat-ended one carves out the inside of it. So you'll see in a moment after this touch test that this thing's going to really get rocking, and it takes about, it says 10 minutes here, so 10 minutes for this to mill. Okay, so this is an example of a block that the crown was partially milled, but we stopped it so that we could have it to show people. So this block sits in the machine like this. The pointy burr carves out the top of the crown. The flat burr carves out the inside of the crown. And so it just goes step by step until this crown is completely done. Now this is a back tooth. Stacy's are front teeth, but it works on the same principle. So the first crown, or in this case veneer, is completed, and the milling machine separates the crown from the block by leaving a little tiny piece called a sprue. I have to remove that by hand, and then this crown will be finished its first step in the milling process, and we're going to put the next crown in and continue the process. So now that the crown, or as I said before, in this case is the veneer, is out of the machine, it's ready to be stained and glazed to go into the oven to fire to make it its final color. I didn't say earlier, but the reason that all these crowns that we're doing look purple is that the material is manufactured in a softer state so that it can actually be milled. And the cool thing about this technology is that once it's fired in the oven, it becomes the tooth colored. It becomes the color of the tooth. We're just going to add we're going to smooth it out with some glaze, and we're going to add a little bit of characteristics to right down at the gum line. We've got this particular tooth glazed, so we're going to gently grab it, open these up, and we're going to now put it on this little pad of putty, which is what this veneer is going to get fired in the oven on. So we're going to do all 6 of these just like that, and then it's going to go into the oven, be cooked, and these things will look absolutely beautiful when they come out. As a review, what we did today for Stacy, we call our Smile in a Day, is we saw Stacy a week or so before her appointment, and we took some impressions, and we did some work prior to her appointment. When she came in, we basically took her existing teeth in her mouth, and using the CAD/CAM technology that's commonly called CEREC, we took a block like this of porcelain. It's not actually porcelain, it's called lithium disilicate, but it's like porcelain. And through me designing the crowns, or in her case the smile, we were able to come up with 6 beautiful crowns like we see over here on the mirror. So The technology is fascinating, the fit of these things is phenomenal, and the aesthetics is phenomenal, as you'll see. So our next step with Stacy is to bond these restorations in, and she will then have her beautiful smile.